Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Abdominoplasty. So, what is an abdominoplasty? It's an operation that's used to remove the skin and fat below the umbilicus, an area that people call the spare tire, and all the tissue above that area is pulled down, and you're leaving you with a scar in your panty line. It literally only deals with the tummy area. It doesn't really deal with the hips or the waist to any great degree. And it's only really good as part of a generalized lifestyle change. Diet, exercise. If you modify your lifestyle in conjunction with this surgery, then you'll get great long-term benefit from it, because the weight can easily be put back on over time. Tummy tuck or abdominoplasty is often better or more effective in ladies, and that's because the way we put fat on as we get older varies between the sexes. In men, it's often internally around the internal organs, creating the so-called beer belly. This cannot be treated by abdominoplasty, whereas in ladies it tends to be outside of the muscles under the skin, and this is very much amenable to abdominoplasty and liposuction procedures. So what will happen after your tummy tuck? So typically it'll be a 2-night stay in hospital. There'll be a small drain, a plastic tube that diverts fluid away from underneath the skin and fat that's been moved, and stopping fluid from collecting underneath the skin. In the majority of cases, they go home the following day, but often 2 nights is best to plan for. You'll wake up wearing a binder or a garment. This applies pressure, giving you a big, comfortable hug, really, to hold the tissues down and keep everything in place. This will be worn for around about 4 to 6 weeks following your surgery, and we'll ask you to take it off every day to check there's no creasing or tight bands forming in that area. You'll be able to shower every day as well. The first week following surgery is quite difficult. It's uncomfortable in the tummy area because we'll have tightened up the tummy muscles in the majority of cases, and this will be like wearing a corset on the inside all the time. So the first week's difficult. I usually recommend you don't try and walk around too much, but by the end of the first week, and certainly by the end of the second week, you're back to your usual self, and the vast majority of patients feel that it's been worthwhile. So things that typically happen after a tummy tuck procedure, well, it'll be painful and tender to begin with. There'll be bruising that usually takes a couple of weeks to settle down. The area will be tender and the area will be numb. The whole tummy will feel quite numb, but this will come back over a period of a few weeks to a few months, localizing as an area of numbness around the scar itself. Rarely, this numbness could be permanent. Often in the early phases there are lumps and bumps and puckers, and these are all quite normal and usually settle within a few weeks. You'll notice the difference as the time goes by. So what things can happen after the surgery? Well, the scar runs from hip to hip. The midpoint of the scar is the tightest point, and at this area it typically opens up or forms a small scab that takes a few weeks to heal. Often you'll need to wear a small piece of gauze in your panties in order to facilitate this. Sometimes it will heal with a slight stretching of the scar. Again, this is quite normal. At either end of the scar there's often puckers, and this is quite normal, especially in the early phases. In the vast majority of occasions these settle down. They're called dog ears. I'm not quite sure why. But if they do persist or they become a problem, they can easily be remedied under local anaesthetic in the clinic. A large number of absorbable sutures are used underneath the skin to stitch the wound together. Sometimes these can spit out. It's a bit like a splinter being forced to the surface, typically presenting as a little blister. It's not uncommon and often will settle as soon as the knot of the suture is expelled, usually in the shower. You wouldn't even know it had happened. If you went to a walk-in centre, for example, they'd probably treat you for an infection, but these don't need antibiotics or any ointments. They just simply need time for the stitch material to be expelled from the body. Other issues with the scar include things like asymmetry of the scar. The scar might be slightly longer on one side or tilted slightly from the other side. The idea being that although the scar may be asymmetric, the contour of the tummy remains symmetric. Sometimes the scar is reported to be sensitive, and this is not something I've really come across, but I'm aware that this is a complication. In the early phase, if you do too much activity early on, you can get fluid forming underneath the skin and fat, causing what we call a seroma. This often will resorb on its own, but sometimes we'll need a needle to be introduced in the clinic for the fluid to be tapped off. This doesn't hurt because the area is usually still numb and may need to be repeated a number of occasions after the surgery in order to allow it to settle down. Sometimes the appearance will change. You'll feel your hips may look wider, or any stretch marks above the umbilicus will now be lower on the tummy. Any moles and tattoos will also be moved accordingly. Fat necrosis can happen. This isn't actually necrosis of the fat, but fat in our body is liquid, but when the blood supply is poor, this can cause the fat to harden and be manifest as lumps under the skin. It's not something I've particularly noticed in my practice, but it is something that is known to happen, especially in smokers. Damage to the umbilicus can also occur. This may be caused by damage to the blood supply, in which case the umbilicus may form a scab or crust, which will take time to heal and come away. Hopefully, in the majority of cases, if this does occur, it will leave a very similar looking umbilicus behind, because after all, the umbilicus is the leftover scab from the umbilical cord. Trying to reconstruct an umbilicus is very challenging and a difficult thing to do. Other issues with the umbilicus include it being a little bit too high, too low, slightly to the left or right. I've not come across this yet in my practice, but this is something that can happen and again is very difficult and challenging to correct. So rare complications that are serious that occur during abdominoplasty include clots on the legs. These can even embolize to the lungs and cause breathing difficulties a couple of weeks down the line. Bleeding may also occur as an emergency. Typically in the first night, you'll need to go back to theatre as an emergency. The wound will be reopened, the area washed out, the bleeding stopped, and everything sutured back together. Will this change the end result? Probably not, but your recovery will definitely be slower with more bruising and swelling. Infection in this procedure is thankfully relatively low. You may get a superficial infection on the surface, and this will be treated with antibiotics. It would be rare for it to be manifest as anything more than that. Meralgia paresthetica is a rare complication that may occur injuring a nerve that runs from the tummy area down into the thigh. If you cut this nerve accidentally, it can cause a burning, searing pain that is chronic and not easily remedied. It may require treatment by a pain specialist doctor. Aesthetic complications, or those of appearance, are most common complications in all areas of cosmetic surgery. These include feeling that the abdomen hasn't been treated appropriately, so undercorrected or overcorrected if you think it looks too unnaturally flat. You might feel that you're simply unhappy with the result that's been achieved. It doesn't meet your expectations, and that's why I spend so much time trying to go through what your expectations are. I'll never take on a case if I don't think I can meet those expectations in all probability. One of the other things that's quite common is the fact that patients may be unhappy about the results in certain angles or lighting. If that's the case, that's quite normal. There's no way that surgery can make everything look perfect in every angle, every lighting, all the time, especially in this day and age when we're very much under the spotlight and on a camera all the time. Surgeries such as tummy tucks, breast reductions and so forth are designed to make you look good in clothes, but outside of clothes will be telltale signs that you've had surgery, and there's no way we can hide these.